Yeah, so keep your mics on so that, sorry, keep your mics muted and only unmute when you're called upon. And when it's your turn to answer, unmute your mic to respond to the question. You have 30 seconds to respond to the question. Please do not answer a question you did not select, so that everyone has a winning chance. You're free to join in the discussion and ask questions once the correct answer is revealed. You're free to Google the answer. If someone gets it wrong, and you can pretty much mark the question and Google it in between, and when it comes back on the board, then you can answer the question and get the points. The other thing is have fun. Should be a lot of interaction and interesting, and feel free to pick a question. You can pick a question, get it wrong, it goes back on the board, so you can Google, and then in the next round, pick the same question. But you cannot pick, so for each round, you cannot pick. So if someone picks a question and they get wrong, the next person can't pick the same question. So you'd have to wait until the round is over, then you'll be able to pick the next question. All right, what else? So top three gets the highest, with the highest marks, gets to win. First prize, you get a hoodie. Second prize, you get scrubs. Third prize will give you algorithms for you to use. So everyone is a winner, pretty much. Yes. Okay. Any questions? Brian, Kirime, and Daireen, I think your mics are not working. You may not be able to talk. So you need to check on that. But yes, any questions? Okay, so I'm assuming you want me to ask the questions. So let's get that started. I just need to do a new share, game one. Okay, let me just get this sorted. Okay, so who wants to go first? Just unmute and say which question.
This is Sarah. I'll go first. I'll kick it off.
Okay.
Oh, okay. Can I take trauma for 200?
Okay, so trauma for 200. Okay. All right, so a 29-year-old man presents the ED with a gunshot wound to his right chest. His blood pressure is 110/80, heart rate 101, respiratory rate 16, and the pulse oxygenation is at 95% on room air. You suspect an open pneumothorax. Which of the following is the most important immediate step in the management of this patient? Endotracheal intubation, B, packing the wound, C, placing a chest tube through the chest wound, and D, placing an occlusive dressing over the wound with tape on 3 sides.
I'm gonna assume this means his airway is intact. I'm gonna do answer D.
Okay.
Place an occlusive dressing.
All right, correct. Oops, sorry. Yes, correct. So essentially, the patient has an open pneumothorax, and the treatment is putting an occlusive dressing with one side open to allow ventilation. We don't see a lot of gunshots, but probably we see a lot of stab chests. And so the immediate treatment is this. And Sarah, what would you do after this?
After this, I'd probably prepare to place a chest tube.
Yes, so
or get a chest X-ray, but yeah.
Yeah, so this patient will definitely need a chest X-ray, but the initial treatment is open 3-sided dressing, occlusive dressing on one side. All right, who wants to go next? So that's 200 points for Sarah.
Y'all better step up to the competition. It's not fair. It's not fair if I went off that question because I'm from America. We do nothing but gunshot wounds, right?
Yeah. So the questions are easy. So guys, feel free to just pick a question. It's not that hard.
Hi.
Yes. Name?
This is Frederick.
Frederick. Okay. Which question would you like to pick?
ECG is 200.
ECGs for 200. All right, let's see. ECGs for 200. Okay, if I could just get my... All right, so ECGs for 200. 46-year-old female is referred into the emergency department after multiple syncopal episodes. On arrival, she's alert and looks well. However, as the ECG is being performed, she slumps over and essentially collapses. Which of the following is the most appropriate initial management? A, amiodarone. B, defibrillation. C, magnesium sulfate. D, transvenous pacing.
Okay, I'll take B, defibrillation.
B, defibrillation. Okay, and that is correct. Okay, so as much as the patient, so Freddie, what condition do you think this patient suffered from?
It looks like the patient went into a VFib.
Okay, so actually it's a special kind of refib. It's torsades au point. Yes, exactly. So he initially on the initial ECG, you can see there was a prolongation of the QT interval. So prolongation of the QT interval, and then suddenly that's when the patient collapsed. And with that, then pretty much went into a torsade. So initial treatment would be defibrillation. But part of the treatment would include magnesium sulfate instead of amiodarone. Yes, so congratulations, Freddie, on that one. Good, let's go back to the board. All right, who's picking up the next one? Anyone, it's not that hard. These questions are very easy. Unmute your mic. Yes.
David for trauma for 200.
Okay, trauma 200 has been done already, David, so you need to pick another one.
EMS for 200.
EMS for 200, all right. So David, EMS for 200. This is easy. A spinal injury can lead to A, anaphylactic shock, B, cardiogenic shock, C, hypovolemic shock, D, neurogenic shock, E, psychogenic shock.
D.
Which one? D is neurogenic shock. And that is correct, David. So spinal cord injury pretty much can lead to neurogenic shock, which is easily characterized by arterial hypotension, bradycardia, and hypothermia, especially if your patient is not able to generate any more heat, and essentially leading to a sympathetic dysautonomia. So congratulations. Yes, spinal cord injury can lead to neurogenic shock. Okay, so back to the board. Good, who's next? So far we have Sarah, David, and Fred tied at 200 points each. Come on, pick a point. The questions are not that hard as you've seen. Anyone? We have 16 participants on this call. There are only 25 questions. Check your mic. I can see some people logged in at the mic. Joey, Maureen, Vivian, your mics are not working. Anyone wants to pick a question, do not worry if you get it wrong. You get a chance to Google it. All right, 80-second takers, because the first people are not taking the people don't want to answer. People don't want to win. Any second takers?
Freddie?
Yes, Freddie.
I'll take a trauma for 300.
Okay, so Freddie, trauma for 300. Okay, let's look at the question. All right, so an 18-year-old man's right leg is trapped beneath his overturned vehicle for nearly 3 hours before he's extricated and brought to the ED. On arrival, his right lower limb is extremely cool, mottled, insensate, and motionless. Despite normal vital signs, pulses cannot be palpated below the femoral artery. The compartments of the lower extremity are firm. Which of the following is the most likely to improve the chances of limb salvage? So, administering anticoagulant drugs, administering thrombolytic therapy, immediately transferring to a trauma center, and D, performing right lower limb fasciotomy.
Okay, I'll go with D.
All right, performing right lower limb extremity fasciotomy is correct. Okay, so the patient pretty much is suffering from compartment syndrome, which is most commonly associated with long bone fractures, the tibia. The 6 P's of compartment syndrome is paresthesia, pallor, pulselessness, cool extremities, paralysis, and pain out of proportion to the exam. All right, so normally it's a swelling within a compartment, mainly in the lower limb. Increased pressures compressed on the blood vessels and the nerves leading to compressed blood flow. So if your patient has any of the clinical symptoms like this patient, essentially then they need to get a fasciotomy done to release the pressure. Good job, Freddie. So currently Freddie leading at 500 points. Sarah 200, David 200. People, it's not that hard. Jump in. Anyone? Second takers, welcome.
All right, this is Sarah again.
Yes.
I'll take one, but I feel like you guys need to take them early while they're still the easy questions, right? It's going to probably get higher stakes as it goes on. Just saying.
Yes. Yes.
Right? Is that true? Or are the questions harder? The higher point questions are harder?
Not necessarily. You could get 500 points
Oh,
from a very simple question. Yes.
So you might just get lucky. Okay.
Yes.
All right.
So which one?
Then I will take ECGs for 300.
So ECGs for 300.
We did 200, right? 300.
Yes, 200 is done. So
yes.
ECGs for 300. All right. A 55-year-old man presents after a syncopal event. He states he just started a new blood pressure medication. His heart rate is 41 beats per minute and his blood pressure is 95/60. His ECG shows sinus bradycardia. Which of the following medications should be administered? A, adenosine, B, atropine, C, diltiazem, D, procainamide.
All right. Well, it says it's a sinus rhythm, so I don't think he needs adenosine or diltiazem, so I think I'd give him atropine.
All right, and the correct answer, yes, is atropine, okay? And patient essentially has a sinus bradycardia, which is essentially same as a sinus rhythm, except the rate is less than 60 and usually more than 45. There's a period before every QRS complex that makes it sinus. The causes of sinus bradycardia increase vagal tone, like Kipchoge and his friends who are well-trained athletes, AV blocking, medication. Interesting, the guy who cycles, Lance Armstrong's resting heart rate is like 30 beats per minute. So this patient probably is on an AV blocking medication for his hypertension that's causing this. 6 sinus syndrome, hypothyroidism, hypothermia, hypoglycemia, and obstructive sleep apnea all can cause sinus bradycardia. Well done. So currently the scores are Sarah 500, Freddie 500, David 200. All right, who's next? Come on, guys, just pick a question and answer. It's not that hard. Getting it wrong is part of the game.
Hi.
Hi.
Naomi.
Naomi, yes.
ECG 300 has been done, so
yes.
ECG 400.
ECG 400 for Naomi. All right, so ECG 400. Okay. All right, which of the following best describes the finding seen in the ECG above? A, left bundle branch block, B, right bundle branch block, C, third degree AV block, D, type 1 second degree AV block.
That's a right bundle branch block.
All right, and Naomi has just jumped in and is at 400 points correct. That's a right bundle branch block. As you can see, there's an RSR pattern in your V1 lead Okay, that pretty much, and more or less not a complete RS pattern in your V5, V6. The right bundle branch block characterized by wide QRS complexes, triphasic QRS complexes, RSR variant in lead 1, and wide S waves in lead 1, V5 or V6. So this one you can see them in V5, V6. There's wide S waves, or what we call an RS pattern in V5, V6 in your lateral lead. So congratulations, Naomi currently at 400. So we have at the moment Sarah at 500, Freddie at 500, Naomi at 400, and David at 200 points. Well done. Who's next? Try the 100 questions. This one should be very easy. Anyone can try.
Hi, David.
Yes, David.
Trauma for 100.
All right, so David, trauma for 100. All right, let's have a look. Trauma 100. All right, 33-year-old man presents complaining of pain to his left eye after he was hit by a football. He reports decreased vision and photophobia. What is the name of his condition? A, retinal hemorrhage. B, hyphema. D, globe rupture. And sorry, C, globe rupture, and D, traumatic conjunctivitis. What's your answer, David?
B for boy.
B for boy, hyphema, and correct. So hyphema essentially happens after trauma to the eye. There's clinically presents with decreased vision, photophobia, pain, and absence of the red reflex on fundoscopy. As you can see, pretty much is blood hanging out in the anterior chamber. There are different grades. There's grade 1, which is less than a third. Grade 2, which is a third to a half. Grade 3, which is more than a half of the field. And grade 4, what we call an 8-ball hyphema, which is the total anterior chamber is covered. Treatment, pretty much keep the patient's head elevated 30 to 45 degrees up. Do not give antiplatelets or anticoagulants. Do not give carbonic anhydrase inhibitors in sickle cell patients. And the patient needs to see an eye doctor. Most of them do get better. Good job, David. All right, so next, who wants to go next? Come on, guys, easy questions. I know some of you by name. I can see your names here. So come on, let's try some of the questions. Anyone? So far, Sarah is at 500, David 300, Freddie 500, Naomi 400. Anyone wants to give a shot? People, come on, pick a question. All right, second takers. Anyone who wants to get more marks?
David.
Yes.
EMS for 400.
All right, so David, EMS for 400. For 400.
Yes.
All right, good. So David, EMS for 400. A 27-year-old man presents the ED after a marathon. Which of the following would make you more concerned for heat stroke as opposed to heat exhaustion? Altered mental status and hyperpyrexia, diaphoresis and seizures, hyperpyrexia and anhidrosis, muscle cramping and vomiting. C, hyperpyrexia and anhidrosis, unfortunately, is not the correct answer. All right, so the question goes back to the board, which means guys can Google it and ask for it at the next round. Good. Next question. Anyone?
Hi.
Hi.
Trauma for 500.
Name?
Sarah.
Sarah, trauma for 5. Sarah, okay, we have two Sarah. Sarah Ashley, and this is Sarah?
Kamamo.
Sarah Kamamo, trauma for 500. All right. A 35-year-old man presents to the ED with shortness of breath and chest pain. Vital signs are blood pressure 132/75 millimeters, heart rate 106, respiratory rate of 22 per minute, oxygen saturation at 96 on UMEA. Physical exam is notable for tachycardia and tachypnea with respirations labored and shallow. You note inward movement of a segment of his chest wall with inspiration and outward movement of the segment of the chest wall with expiration. Which of the following is the most likely cause for this patient's diagnosis?
Hi, I think it's abdominal trauma.
Thoracoabdominal trauma, and that is the correct answer. Pretty much your patient has a flared chest. Flared chest is the one that causes an unstable segment moving in the opposite direction of the injured in normal functioning chest wall. Okay, so you have 3 or more adjacent ribs, each fractured in 2 places. So on inspiration, normal chest wall expands, flared segment contracts, it goes down. On expiration, normal chest wall contracts, flared segment expands. So well done, Sarah Kamamo. All right, let's have a look at where we are on the scores. So we have Sarah Ashley and Sarah Kamamo both tying at 500 points. Also Freddie at 500 points. Naomi at 400 points. David at 300 points. Good job. All right, we still have multiple questions on ENT. All these questions are questions of patients who show up to the emergency department. So it's not hardcore questions for ENT specialists. And lucky dip pretty much means you get to choose, you get to get different types of questions. So who wants to go next?
Maureen.
Maureen, all right, which question?
EMS 400.
EMS 400, we'll have to pick it up in the next round because David tried. You want to pick another one?
EMS 100.
EMS 100, all right. So Maureen, EMS 100, let's go for it. Should go upwards, not downwards. All right. So EMS 100, which of the following is the most important during patient assessment? A, getting a prompt sample history. B, keeping the patient comfortable. C, maintaining an open airway. D, obtaining verbal consent. E, performing rapid body assessment.
C.
C, maintaining an open airway is the correct answer. And yes, when in doubt about management options, always fall back on your ABCs. Well done, Maureen. You get 100 points for that. Good job.
Thank you.
All right, who wants to go next?
Naomi,
Naomi, yes.
ENT 200.
ENT 200, Naomi, all right. Let's have a look at that, ENT 200. All right, a 37-year-old woman presents to the emergency department for epistaxis. After 10 minutes of direct pressure and application of a topical vasoconstrictor, inspection with the nasal speculum and suctioning, you note a significant amount of active bleeding on the right side, but are unable to locate the vessel. What is the best next step in the management of this patient's epistaxis? A, cautery with silver nitrate. B, irrigation with normal saline. C, placement of an anterior nasal pack. D, placement of a posterior nasal pack. Answer is?
I'd have to go for inactive D.
You'd go for your answer is?
D.
D for dog?
Yes.
All right, so unfortunately, D is not the right answer. Okay, better luck next time. So we go back to the board. All right, so any questions that someone didn't get right, will be back in the next round, and you can Google the answer between now and then. And even you who didn't get it, you can Google the answer and pick it up in the next round. All right, so who wants to go next? Come on, guys. It's not that hard, as you've seen. Second takers.
Ready?
Freddie, yes.
ECG is 500.
ECGs, hey, you're going big. Good. All right, so ECGs 500 for Freddie. All right. ECGs 500. Okay, good. An elderly man with congestive heart failure presents the ED with complaint of not feeling normal. He's on several different medications. His ECG is shown above. Which of the following medications is the most likely cause of this ECG abnormality? A, digoxin, B, furosemide, C, metoprolol, D, warfarin.
Okay, I'll go with A, digoxin.
A, digoxin is the correct answer. All right, so what you're seeing on the ECG is what we call the dig effect. Okay, so it's an up, like a reverse tick sign, down-sloping ST depression with a characteristic slurred appearance, flattened, inverted, or biphasic T waves, shortened QT interval, which is what we are seeing on the ECG here. So that is dig effect. It just means the patient is on digoxin, has no real pathological meaning. And with that, of course, then Freddie is leading at 1,000 points. Good job, Freddie. Sarah is at 500 points. Naomi is at 400 points. Sarah Kamamo is also at 500 points. David is at 300 points. Maureen is at 100 points. All right, good job, everyone. All right, we still have a few more questions. So we have the following questions are still available. Trauma 400, EMS 300, EMS 500, ECGs 100. That should be a simple ECG. ENT 100, 300, 400, and 500. And the whole of Lucky Dip is still open for people to take. All right, who wants to go? Sorry?
Maureen 500.
Maureen 500, which category?
EMS.
EMS, Maureen 500. All right, let's go. A patient opens his eyes to painful stimuli. His speech is incomprehensible and he withdraws to pain. What is his GCS? A, 12, B, 6, C, 8, D, 15. So opens eyes to painful stimuli, speech is incomprehensible, withdraws to pain. What is his GCS?
A.
A, 12, and fortunately is not the correct answer. So it goes back to the board for the next round. All right, don't worry. Guess you can now calculate it and pick it up in the next round. All right, who wants to go next?
David,
David, yes?
trauma for 400.
Trauma 400, David, all right. You are taking care of a 24-year-old man who has sustained severe blunt force to his chest wall in a motor vehicle collision. His initial chest radiograph showed severe pulmonary contusions and no evidence of broken ribs or pneumothorax. 1 hour later, he is experiencing worsening respiratory functions. His vital signs are temperature 37.1, heart rate is 100, BP 110/60, respiratory rate is 30, pulse ox 90 on BiPAP. A repeat chest radiograph reveals bilateral pulmonary edema without evidence of cardiomegaly. What is the most appropriate next step in the management of this patient? A, give IV furosemide. B, administer intravenous high-dose methylprednisolone. C, continue oxygen by non-rebreather mask until his saturation drops below 90%. D, obtain blood cultures and administer broad-spectrum antibiotics. E, perform endotracheal intubation?
E for elephant.
Perform endotracheal intubation is the correct answer. So you David gets 400 points from that. So the patient is having worsening respiratory symptoms in a patient with what we call non-cardiogenic pulmonary edema secondary to lung injury. And he was initially put on BiPAP, but he's not getting better. So he is getting worse and thus needs to be intubated. So causes of non-cardiogenic pulmonary edema is acute respiratory distress, which was what we are seeing a lot with COVID, high altitude pulmonary edema, neurogenic pulmonary edema, opioid overdose, pulmonary embolism, eclampsia, transfusion-related lung injury. So treat underlying condition, antibiotics if there's an infection, supportive care, mechanical ventilation, adequate nutrition, hemodynamic monitoring. Well done, David. All right, good. We still have a couple of more questions before the end of this round. Any takers? So trauma is finished. We still have EMS 300, ECGs 100, and a lot of ENT and lucky dip.
Vivian,
Vivian, yes.
EMS 300.
All right, so let's go. Vivian, EMS 300. All right, you respond to an 18-year-old man stabbed in the chest. His BP is 80/40, pulse is 130, respiratory rate is 30, and the oxygen saturation is 85% on room air. He appears short of breath and is severe respiratory distress. He's been stabbed in the chest. He has diminished breath sounds noted on the right side of the chest where he was stabbed. What is the next most appropriate step in the managing of this patient? A, needle thoracostomy of the right chest. B, give oxygen via face mask. C, place a right-sided chest tube thoracostomy. And D, rapid sequence induction and intubation of this patient.
I'll go with, please. B.
B, unfortunately, is not the correct answer. Please, well done for trying. You can pick it up in the next round. Okay, so that's okay. So ENT, we have a lot of ECG 100 is available. ENT questions and lucky dip questions are available. Come on, guys.
Naomi,
yes.
ECG 100.
All right, so Naomi, ECG 100. Okay, a 50-year-old woman presents to the emergency department with minor chest pain. She lifted some heavy groceries from the car yesterday. She has a history of hypertension that is controlled with metoprolol. In the ED, her vital signs are BP 120/80, heart rate 68, resp rate 14, and oxygen saturations of 99% on room air. Her rhythm strip is seen above. Which of the following is a rhythm represented? A, first degree heart block. B, third degree heart block. C, type 1, second degree heart block. D, type 2, second degree heart block.
The second degree heart block.
Which one?
Yeah, that's a question. I'm going to go with type 1.
Type 1 second degree heart block is the correct answer. All right, so it's a Weckenbach or morbid type 1. Essentially what you see is PR prolongation and progressive PR prolongation, and then there's a dropped QRS complex. So there's a PR interval, it gets bigger, then there's a dropped beat. PRs and QRS complexes are normal, but there's a dropped beat. PRs without QRS complexes, PR interval progressively lengthens. RR Interval progressively shortens until a beat is dropped. Leads to group beating. The block is almost always within the AV node. Congratulations, Naomi. Well done on that one. All right. So, guys, we only have ENT questions and lucky dip questions remaining.
Maureen, lucky dip, 200.
Maureen, lucky dip 200. All right. Okay, let's have a look at that. All right, an 18-year-old woman presents after having a syncopal episode. She fainted. She is complaining of a 2-day history of low abdominal pain and vaginal spotting. Her BP is 86/42. Heart rate is 128 beats per minute. Respiratory rate is 18 breaths per minute. Oxygen saturations are fine at 99% on room air. She's drowsy but answers questions appropriately. Which is the most appropriate next step in the management? A, establish large bore IV access and administer IV fluid bolus. B, initiate rapid sequence induction and orotracheal intubation. C, perform a bedside urine pregnancy test. And D, perform an ultrasound of the abdomen to assess for free fluid.
A.
A, establish a large bore IV access and administer IV fluids is the correct answer. All right. As we always say, when in doubt, all in your management, always fall back to your ABCs. So her circulation is compromised, so we need to fix that first. So congratulations, Maureen, you get 200 points for that. Well done. All right, who's going next? Come on, we've got a lot of ENT and lucky dip, not that hard questions.
David,
Yes, David.
lucky dip 300.
Lucky dip 300 for David, all right. A 23-year-old woman presents with acute onset dizziness and palpitations. Her ECG reveals evidence of AV nodal reentry tachycardia with a heart rate of 170 beats per minute. Her blood pressure is 140/70 millimeters per mercury. Which of the following would be the most appropriate initial management or treatment? A, atropine. B, cardioversion. C, Valsalva maneuver. D, midazolam.
C.
Okay, that's C, Valsalva maneuver. Correct. Okay, so your patient essentially has an SVT, so you can see the heart rate more than essentially 180 beats per minute, has around 150 beats per minute, sorry. QRS complex and arrow. Initial treatment is vagal maneuvers and then adenosine if required. Good job, David, well done. All right, some more questions. Anyone next? So we have ENT and lucky dip. Come on, guys. Yes.
Let me try lucky dip 100.
Whose name?
Sigay.
Sigay, lucky dip 100. All right. Let's have a look at that. An 18-year-old man presents the emergency department after being found down outside near a barn. He is awake and following commands, but is unable to recall recent events. He exhibits lower extremity weakness. His vital signs are within normal limits for his age. Physical examination reveals the findings shown in the image across. Which of the following is the most likely diagnosis? A, spider envenomation. B, lightning injury. C, strangulation injury. D, thrombophlebitis.
Jeez.
Make a guess. Okay. It's a lucky dip.
Lower extremity weakness.
Yes, he was found outside near a barn.
Okay. Could it be lightning? But I don't know.
Is that your final answer?
Let me think about this. Let me try thrombophlebitis.
Thrombophlebitis, unfortunately, is not the correct answer. Good job. Thanks for trying. All right, you can Google it and find it out in the next round. All right, good. Anyone else next?
Lucky Dip 500.
Lucky
Maureen.
Dip. Who's this?
Maureen.
Maureen. All right, feeling very lucky, I see. All right, so Lucky Dip 500. A 20-year-old woman is climbing Mount Kilimanjaro when she develops a headache followed by vomiting. As you begin to assess her, she has a grand mal seizure. Which of the following treatments should be immediately started? A. Descent and acetazolamide. B. Ibuprofen and dexamethasone. C. Supplemental oxygen and acetazolamide. D. Supplemental oxygen, descent, and dexamethasone. Sorry.
Okay, I'll go for A.
A. Descent and acetazolamide, unfortunately, is not the correct answer. All right, better luck next time. Good job. Thanks for the try. All right, good. ENT questions. No one wants ENT questions.
ENT 200.
ENT 200 has already been taken. You can take it up at the next round because the answer was not correct. Any other one? You want to pick the next one? 100 or 300?
300.
Name? Name? Hello, what's the name?
Sally.
Sally, all right. So Sally, ENT 300. All right, a 21-year-old man presents for evaluation of a sore throat. The patient reports a fever and sore throat for 2 days. On examination, his oropharynx is erythematous with an enlarged tonsils with bilateral exudates. In addition to NSAIDs, which of the following is the best shown to produce greatest reduction in pain? A. Acetaminophen. B. Dexamethasone. C. IV hydration. D. Penicillin.
B.
B. Dexamethasone is the correct answer. Yes, dexamethasone administered as a single dose of 0.6 milligrams per kg up to a maximum of 10 milligrams is associated with a reduction of pain and duration of pain in patients with moderate to severe pharyngitis. Well done, Sally, on that one. All right, so we still have ENT 100, 400, and 500, and Lucky Dip 400.
Lucky Dip 400.
Name?
Emily.
Sorry?
Emily.
Lucky Dip 400. All right. Long question. Don't panic just yet. All right. So a 24-year-old woman presents the emergency department reporting a sexual assault 12 hours ago. She denies any previous medical history and her menstrual period was 2 weeks ago. She reports unwanted sexual activity last night and does not recall all the events. You notice that she has bruising on her wrists and on the left side of her face. She's in obvious psychological distress and requests further forensic evaluation. While you are waiting sexual assault nursing exam, in addition to emergency contraception, what testing and treatment should be provided to prevent infectious complications? A. Pregnancy testing and treatment with ceftriaxone, azithromycin, and post-exposure prophylaxis for HIV. B. Pregnancy testing and treatment with ceftriaxone, azithromycin, metronidazole, hepatitis B vaccination, HPV vaccination, and post-exposure prophylaxis for HIV based on risk assessment. C. Pregnancy testing, treatment with ceftriaxone, azithromycin, metronidazole, penicillin, hepatitis B vaccination, hepatitis B immunoglobulin, HPV vaccination, and post-exposure prophylaxis for HIV. D, provide testing for gonorrhea, chlamydia, trichomonas vaginalis, hepatitis B, and a lot of other Treponema pallidum and HIV, which is the correct answer in the management of a sexual assault victim.
I'd go with C.
C is the correct answer. Well done, Emily. So yes, so patient needs ceftriaxone for Neisseria gonorrhea, azithromycin for chlamydia trachomatis, metronidazole for trichomonas vaginalis, hepatitis B vaccination without hepatitis B. We're going for those who have not been vaccinated before, but she's probably not been vaccinated before. That's why she gets immunoglobulin. HPV vaccination for females 9 to 26 and males 9 to 21, and post-exposure prophylaxis for HIV based on risk assessment, and emergency contraception with Plan B or other treatment options. Well done, Emily.
Just a quick question.
Yes.
There was penicillin in that choice as well, or not?
That's Lucky Dip 400. Yes. Sorry, let's see. HPV vaccination. Oh, yes, actually. There was penicillin on this, which ideally is not there, but let's see, pregnancy test and treatment with ceftriaxone, erythromycin, hepatitis B vaccination, HPV vaccination, and P post-exposure prophylaxis for HIV. Based on the fact, yeah, so she would get, so there is, the penicillin there is the wrong answer, but she would need an immunoglobulin treatment also. That's why she gets both. So the error is on our side on the penicillin, not required though. So Emily still get the 400 points. All right, good. We have 3 more questions left on the board: ENT 100, ENT 400, and ENT 500.
ENT 500.
ENT
Sally.
name? Sally, ENT 500. All right. A 45-year-old woman presents with a sore throat and neck pain for 2 weeks. She reports fever, adenophagia, and pain in neck movement. Physical examination reveals a right pharyngeal mass displacing the uvula to the left as shown above. So that's the mass you're seeing over there. What structure is most at risk for injury during the management of this condition? A, internal carotid artery, B, internal jugular vein, C, phrenic nerve, D, vagus nerve.
D.
D, vagus nerve, unfortunately, is not the correct answer. All right, so the question goes back to the board. All right, good. We have ENT 100 and ENT 400.
David, ENT 400.
David, ENT 400. All right, so a 72-year-old man complains of painless decreased vision in his left eye associated with flashing lights and floaters. Visual acuity in the left eye is 20/200 and the right eye is 20/30. Which of the following is the most likely diagnosis? A, acute angle closure glaucoma, B, optic neuritis, C, retinal detachment, D, temporal lateritis.
Retinal detachment.
Retinal detachment is the correct answer. Okay, so essentially it's usually painless. Pretty much the retina starts peeling off from behind and there's fluid behind the retina. Vitreous detachment is associated. The key diagnosis here is your floaters, photopsia, flashings of light, and visual field defect, cutting coming down. Okay, it's an ophthalmological emergency. Patient needs to go to see an ophthalmologist. Good. Now, final question that's available before the end of this round is ENT 100. Who's taking it?
ENT 100.
Name?
Isabel.
Isabel, all right. ENT 100. A mother brings her 2-year-old boy to the emergency department because she thinks he swallowed a coin. She found her son coughing initially, but later he seemed fine. On examination, you note the patient is drooling, but is in no respiratory distress. You obtain a radiograph seen above. Which of the following statements is correct regarding this patient's diagnosis? A, the coin is in the esophagus, so the child can be discharged home and have a repeat radiograph in 48 hours to see if the coin has passed. B, the coin is in the esophagus, so the child will need emergent endoscopy to remove it. C, the coin is in the trachea, so the child can be discharged home and have a repeat radiograph in 48 hours to see if the coin has passed. And D, the coin is in the trachea, so the child will need emergent bronchoscopy to remove it. All right, what's your answer?
D, the coin is in the trachea, so the child will need emergent bronchoscopy to remove.
Unfortunately, Isabel, that's not the correct answer. All right, and we go back, it goes back to the board. Good, all right, so this is round one, and before there are a few questions that we can quickly go through and before we tally the marks from the winners of round one. So I'll mention the questions that are still available that were initially gotten wrong, and you can tell me which question you want to answer, and then we will, if you get the answer wrong, then we'll look at the correct answer, and but you will not get marks for that. Okay, so the questions that are available: EMS 300, EMS 400, and EMS 500. We have ENT 200 is available, and then ENT 500 is available. Lucky Dip 100 and Lucky Dip 500. Any takers?
Maureen, EMS.
EMS, which one? There is EMS 300, 400, 500. Which one do you want? Maureen?
500.
Maureen, reattempting her last question, EMS 500. A patient opens his eyes to painful stimuli. He is incomprehensible and withdraws to pain. What is his GCS?
C8.
The GCS is correct. Okay, so Maureen, you get 500 points for that. The GCS is 8. We can see so he opens his eyes to painful stimuli. That is a 2. His speech is incomprehensible. That is a 2. And he withdraws to pain, and that is a 4. Totaling 8. Congratulations, Maureen. You get 500 points for that. Okay. All right, we go to the board. All right, what's next?
David, Lucky Dip 500.
David, Lucky Dip 500. All right, 20-year-old woman climbing Mount Kilimanjaro when she develops a headache followed by vomiting. As you begin to assess her, she has a grand mal seizure. Which of the following treatments should immediately be started? A, descent and acetazolamide. B, ibuprofen and dexamethasone. C, supplemental oxygen and acetazolamide. And D, supplemental oxygen and descent and dexamethasone. What's your answer?
C.
C is not the correct answer. And this question then, of course, the correct answer would be D. Your patient has to descend, all right? So the treatment for mountain sickness essentially requires immediate intervention. Descent is definitive. Person is still ambulatory, dexamethasone, supplemental oxygen, and hyperbarics, okay? So that question, no marks, no one gets any marks for that question. All right, good. Questions available, there's still EMS 300, EMS 400, ENT 200, and ENT 500. And
EMS 500?
EMS 500 was answered.
Oh, 400?
EMS 400, yes, that is available. Name? What's your
Sally.
name? Sally, all right. So EMS 400. A 27-year-old man presents the AD after a marathon. Which of the following would make you more concerned for heat stroke as opposed to heat exhaustion? A, altered mental status and hyperpyrexia. B, diaphoresis and seizures. C, hyperpyrexia and anhidrosis. D, muscle cramping and vomiting.
A?
A, altered mental status and hyperpyrexia is the correct answer. All right, so essentially the difference in terms of heat, you have heat cramps at the bottom, which is inadequate intake of fluids and electrolytes, muscle cramping and curls on the abdomen. You have heat exhaustion, which is pretty much dehydration, nausea and vomiting, general weakness. Heat stroke is mental status change, organ damage, and hydrosis. Congratulations, Ali. You get 400 points for that. All right, so other questions is EMS 300, ENT 200, ENT 500, Lucky Dip 100.
Naomi, Lucky Dip 100.
Naomi, Lucky Dip
ENT 500. No.
Who is who now?
Two people are talking right now.
Okay, so who wants Lucky Dip 100?
David.
Sorry? Isabel, there was a lady before. Yes, okay. And then there was someone who was speaking just now?
Yeah, Naomi, I wanted the ENT 500.
Naomi, ENT 500. Okay, so we'll start with Naomi, then go to Isabel. Okay, so Naomi, ENT 500. A 45-year-old woman presents with a sore throat and a neck pain for 2 weeks. She reports fever, adenophobia, and pain in the neck movement. Physical examination reveals right pharyngeal mass displacing the uvula to the left, as shown above. What structure is most at risk for injury during the management of this condition? A, internal carotid artery, B, internal jugular vein, C, phrenic nerve, D, vagus nerve.
I'm going to go with B for boy.
B for boy, unfortunately, is not the correct answer. The correct answer is actually internal carotid artery. So the patient has peritonsillar abscess, which management is needle aspiration. Okay, and essentially the carotid artery lies directly behind at the back there. Yes, so what's pertinent is taking care not to get into the carotid artery, and that's why you have a needle guard that prevents you getting into the carotid artery. So unfortunately, Naomi, you don't get that question right. Isabel, we are coming to you. So Isabel, Lucky Dip 100. An 18-year-old man presents the emergency department after being found outside near a barn. He's awake and following commands, but is unable to recall recent events. He exhibits lower extremity weakness. His vital signs are within normal limits for his age. Physical examination reveals the findings shown above. Which of the following is the most likely diagnosis? A, spider envenomation. B, lightning injury. C, strangulation injury. D, thrombophlebitis. Isabel, what is your answer?
Okay. I'd go with spider envenomation.
Unfortunately, spider envenomation is not the correct answer. The patient has what we call a Lichtenberg figure, which is pathognomonic for lightning strike. So he was struck by lightning, and essentially you get a superficial fan or feather pattern from electrical shower on his back. All right, so Isabel, unfortunately you get points for that. It is a lightning injury. All right, so we have, I think, two. So, someone has a question? We have two more questions. We have ENT 200 and EMS 300.
EMS 300.
EMS 300, David. Okay. Yes. Okay. So David, you respond to an 18-year-old man stabbed in the chest. His BP is 80/40, pulse rate 130, respirate 30, and oxygen saturation is at 85%. Okay, on room air. He appears short of breath and is in severe respiratory distress. He has diminished breath sounds noted on the right side. What is the next most appropriate step in the managing of this patient? A, needle thoracostomy of the right chest. B, give oxygen via face mask. C, placement of a right-sided chest rib thoracotomy. And D, rapid sequence induction and orotracheal intubation. Your answer, David?
A.
A, needle thoracostomy of the right chest is the correct answer. Essentially, your patient is having a tension pneumothorax, which leads to lung collapse, tracheal deviation, mediastinal shift, contraction on the side of the pneumothorax, absent breath sounds on that side, so the increased intrathoracic pressure, decreased pulmonary venous return, and hypotension and tachycardia. Putting a needle in just above the margin of the rib in the second intercostal space, mid-clavicular line, will decompress the chest and allow the patient to breathe perfectly well, followed by a chest tube. Final question available. All right, ENT 200. Who wants to take that one?
ENT.
I had Maureen first, so I will go with Maureen. Maureen, ENT 200. 37-year-old woman presents the AD for epistaxis after 10 minutes of direct pressure application of topical vasoconstrictors, inspection with a nasal speculum, and sectioning. You notice a significant amount of active bleeding on the right side, but unable to locate the vessel. What is the best next step in managing this patient's epistaxis? A, cautery with silver nitrate. B, irrigation with normal saline. C, placement of an anterior nasal pack. And D, placement of a posterior nasal pack.
Placement of anterior nasal pack.
All right, that is C, and C is the correct answer. All right, your patient does have epistaxis, most commonly is in the anterior, secondary to the Kisselbach's plexus. That's where most of the bleeding happens. Sometimes you get posterior bleeding from sphenopalatine artery. More common in the anterior, occurs in child and young adults, usually due to dry mucosal dryness, less severe. The posterior one is a bit more common. So, but correct, the correct answer is anterior nasal packing. All right. So that brings us to the end of this round. We have a round 2 of a different set of questions. All right, we'll take a 5-minute break. For those who've joined in late, we'll explain to you what the rules are at the beginning of the next round. So we'll take a 5-minute break to quickly tally all the scores, after which we'll be able to return for round 2. All right, in the interim, please enjoy a nice interval of music from us to you. All right, see you in, let's see, what time is it? So we'll start at 10:30 sharp. We start the next round. So 10:30 sharp, go grab some coffee, some tea, something, and see you exactly at 10:30. We'll tell you the rules when you come back at 10:30 for the ones who joined in late. So starting off at 10:30. So currently at the lead is one David with 1,700 points. Number 2 is Freddy at 1,000 points. Number 3 is Maureen at 800 points. Number 4 is Sally at 700 points. And we have 3 number 5s. We've got Sarah Ashley, we've got, I think, Sarah Kamamo, and we've got Naomi, all tied at 500 points. And then we have number 6 is Emily at 400 points, all right? So for those who are joining in, let's just have a look. Let me just share what the game is about. Yes, this one. Okay, so it's an exciting game show, okay? So the game has different questions on, as you've seen in the last session, we have 25 questions, different categories. The next section will have a different set of questions, a different set of categories. Okay, the key thing is if a question is answered correctly, we remove it from the board. If the answer is answered incorrectly or not answered at all, it goes back to the board for the next round. We repeat all this sequence until all the questions are answered correctly. Please ensure I can tell your name, but by renaming your Zoom, but also please tell me your name when you're picking a question. Kindly keep your mics muted and only unmute when you're answering the question or when you're selecting a question. When your turn is to answer, unmute your mic and respond. Do not answer questions you did not select. You're free to join in the discussion and ask questions as we discuss the correct answer. You're free to Google the answers if someone gets it wrong, and you can choose the question in the next round. Just remember the question code and have fun. Okay. The top 3 winners are the ones who get the highest points. So far with number 1, 2, and 3 at this point is this is for the whole game show, not just round 1. So for you still have a chance of being a leader in the next round. We will tally all the points at the end of the show so that we know who is number 1, 2, and number 3. So currently number 1 is David, number 2 is Freddie, and number 3 is Maureen. Okay, so you are free to catch up and compete, and the rest you're free to keep up your leading points. All right, so first prize, you get a hoodie from us. Second prize, you get scrubs. Third prize, you get a set of our emergency care algorithms. All right, any questions before we start the next round? Are you ready? Okay, so let me just get the second round loaded so that we can kick it off. Slideshow. Okay, all right, so there we are. Okay, and then game 2. All right, so for game 2, we've got pediatrics, we've got EMS, we've got OBGYN, we've got blood gases, and our lucky and very interesting category, lucky dip. All right, the points on each question are the points that you get for answering the question. All right, so who wants to go first?
Lucky dip 400, Janet.
Janet, lucky dip 400. All right, let's go. So, 52. It's a very simple question. So, a 52-year-old man presents to the emergency department with chest pain. He has a history of coronary artery disease, hypertension, and hyperlipidemia. His pain started 14 minutes ago and has been constant. He describes his pain as an elephant sitting on my chest. He reports associated diaphoresis and nausea. Physical exam is remarkable for diaphoretic male patient with clear lungs bilaterally, jugular vein distension, a palpable liver margin, and 1+ pitting edema in bilateral lower limbs. An ECG is performed and is demonstrated above. Which of the following is the most likely cause for this patient's right heart failure? A, acute pulmonary embolism, B, endocarditis, C, left-sided heart failure, D, right ventricular infarction.
All right, let me see. Okay. Right ventricular infarct.
Right ventricular infarction is the correct answer. 400 points for Janet. Okay, so the patient above presents with acute onset right ventricular dysfunction with ECG findings consistent with an inferior wall myocardial infarction. Patients presenting with this ECG should also be evaluated for a right ventricular myocardial infarction, which occurs in up to 30 to 50% on inferior wall STEMIs. And you do this by pretty much doing what we call a right-sided ECG. So the right-sided ECG on this patient showed V4, ST elevations in V3 and V4. And if you look at his past ECG, when you see ST depressions, especially in V2 and V3, with an inferior MI, which is your ST elevation in 2-3 AVF, you should think immediately of a right-sided myocardial infarction and do a right-sided ECG. Congratulations, Janet, you get 400 points for that. All right, who wants to go next?
EMS 500, Sally.
Sally, EMS 500. People are going big. Go big or go home. All right. Wait, EMS 500. How often should you give breast to an adult when ventilating? This is easy. A, once every 1 to 3 seconds, once every 4 to 5 seconds, once every 5 to 6 seconds, once every 6 to 7 seconds, once every 8 to 10 seconds.
D.
D is unfortunately not the correct answer. All right, so it goes back to the board. Yes. Okay, next question. Anyone picking next?
Maureen, EMS 400.
Maureen, EMS 400. All right. Maureen, EMS 400. What is the adult dose for activated charcoal? A, 10 to 30 grams. B, 30 to 40 mLs. C, 50 to 100 grams. D, 60 to 100 mLs. E, 150 to 300 grams.
Let me see. Okay. 10 to 30 grams.
10 to 30 grams, unfortunately, is not the correct answer. So the question goes back to the leaderboard. Okay, remember you can Google your answers and pick it up in the next round. Who wants to go next?
Emily.
Emily, yes.
It's 300.
Emily PIDS 300. All right, let's see that. Which of the following is most characteristics of a complex febrile seizure? A, convulsions are focal in nature. B, convulsions lasting 12 minutes. C, second seizure occurs with second febrile illness. D, single seizure that occurs at a temperature of 40 degrees centigrade.
Okay. I think I'd go with D.
D, single seizure that occurs at a temperature of 40 degrees centigrade, is unfortunately not the correct answer. All right, remember the question, you can always answer it the next round. Okay, who's going next?
Isabel.
Okay, let's go with David first, then Isabel. So David, what do you want?
Lucky Dip 500.
So David, Lucky Dip 500. Isabel, what did you want?
Odds gain 300.
Odds gain 300. All right, let's go. So David, you're first. So David, Lucky Dip 500. You're an EMT on scene in which there was a lightning strike on a wet field. There are 4 people affected by the strike. Which of the following requires your most immediate attention? A, 18-year-old woman breathing in pain with an obvious lower extremity fracture. B, 27-year-old pregnant woman complaining of abdominal pain. C, a 57-year-old man with absent vital signs. D, a 7-year-old boy breathing with radial pulse but otherwise unresponsive. All right, David, we need an answer.
A.
A is unfortunately not the correct answer, so it goes back to the board. Next, we have Isabel for 300 OBGYN. A 24-year-old woman at approximately 40 weeks gestation arrives at the emergency department in active labor. The fetal head is visible at the introitus. As you deliver the head, you note a nuchal cord wrapped around the neck. Which of the following is the most appropriate next step? A. Clamp the cord in 2 places, cut the cord between the clamps, and then proceed with delivery. B. Deliver the fetus and reduce the nuchal cord once delivery is complete. C. Elevate the fetal head back in the uterus by keeping one hand in the vagina at all times, then proceed to emergency C-section. D. Reduce the cord by slipping it over the fetal head and proceed with delivery.
I'd go with D, reduce the cord by slipping it over the fetal head and proceed with the delivery.
Congratulations, that's the correct answer. So a nuchal cord is a loop of umbilical cord around the fetal neck. Essentially, slip the cord over the head when the head is in the perineum and then proceed with delivery. You get 300 points for that, Isabel. Good. Who's next?
Maureen.
EMT 500.
Okay, so I had Maureen and then I had EMT 500. Maureen, which question do you want?
EMS 300.
Maureen, sorry?
EMS 300.
EMS 300 has already been taken. Someone else said EMT?
Vivian EMS 500.
That one has already been answered, so you can only answer it at the next round. All right? Any next?
PIDS 400.
PIDS 400. Who is that?
Janet.
PIDS 400 for Janet. All right. All right. Which of the following best classifies this fracture? Salter-Harris type 1, Salter-Harris type 2, Salter-Harris type 3, Salter-Harris type 4.
Salter-Harris type 2.
Salter-Harris type 2, unfortunately, is not the correct answer. All right, so the question goes back to the board. All right, who's going next? Remember, any of these questions, just Google them in between and be ready to answer them in the next round.
EMS 200, Maureen.
Maureen, EMS 200, all right. Let's have a look at that. Which of the following is not used to report level of response? A, AVPU, B, Glasgow Coma Scale, C, RTS, and D, SALT.
It's RTS.
RTS or revised trauma score, unfortunately, is not the correct answer. All right, so the question goes back to the board. Next.
Nicholas.
Okay, so I had Nicholas first. So Nicholas, which one?
OBS 500.
Nicholas, OBS 500. All right, let's have a look at that. A 36-year-old Gravida 5 para 4 arrives at the emergency department following a precipitous delivery of a term infant on the way to the hospital. Following delivery of the placenta, she continues to hemorrhage. On abdominal examination, her uterus is soft and boggy. Which of the following measures is the most appropriate initial step? A, consult OBGYN to perform dilatation and curettage. B, establish intravenous access and administer methylagonovin. Massage and compress the uterus by placing one hand in the lower abdomen and the other hand in the vagina. D, massage the uterus with both hands on the lower abdomen. What's the correct answer?
C.
Sorry?
C.
D.
C,
oh.
C.
C. All right.
Yes.
So C for cat. All right. So C is the correct answer. All right. Postpartum hemorrhage, essentially cumulative blood loss more than a liter, or bleeding associated with signs or symptoms of hypovolemia within 24 hours of the birth process, regardless of delivery route. Most common cause is the 40s, or most common is uterine atony, which is what this lady is having. trauma to the birth canal, retention of fetal or placental tissues, and coagulopathy or thrombin disorders. All right, so placental massage is the correct, uterine massage is the correct answer to that. Nicholas, you get 500 points for that. All right, who's next?
It's 400. I redo it.
You cannot redo it in this round, but just keep in mind, and the next round, when you open it up, you'll redo it. Good.
Okay.
Next.
Lucky dip 500, Sally.
Lucky dip 500 has already been attempted. Please pick another one.
David, lucky dip 300.
Aye.
All right, so, okay, so David and Sally, what, would you like to pick another one?
OBG 400.
All right, so OBG 400. All right, so we'll start with David, then we'll go to Sally. So David, lucky dip 300. Which type of alcohol poisoning causes blindness? A, ethanol, B, methanol, C, isopropyl alcohol, D, ethylene glycol. David, we need an answer.
A or B?
You can't have it. There's no choice like A or B. Which one causes blindness? Pick one.
A.
A, unfortunately, is the correct answer. So the question, oops, the question goes back to the leaderboard. All right, Sally, for OBGYN 400. A 20-year-old gravida 4 para 3 with a history of gestational diabetes presents the emergency department with a precipitous delivery. The fetal head delivers easily, but routine downward traction fails to deliver the anterior shoulder, and the head retracts slightly against the perineum. Which of the following is the next most appropriate step? A, apply pressure to the uterine fundus to help dislodge the trapped shoulder. B, insert gloved hand into the vagina, elevate the presenting part, and proceed with emergency cesarean section. C, move the mother onto her hands and knees and apply gentle downward traction on the fetal head. D, sharply flex the mother's legs up to the abdomen and hold in place while simultaneously applying suprapubic pressure.
D.
D, sharply flex the mother's legs up to the abdomen and hold in place while simultaneously applying suprapubic pressure is the correct answer, and that is called the Macrobat's maneuver. So in a patient who has shoulder dystocia, where the baby is stuck because of the anterior shoulder is stuck below the pubic symphysis, we have the helper mnemonic for shoulder dystocia. A, call for help. B, evaluate for episiotomy. Macrobat's maneuver is where the legs are pushed towards the mother's chest, and P is apply suprapubic pressure, which is what we were doing. Then we have enter, rotational maneuvers, remove posterior arm, roll patient onto her, pause on her knees and legs. So congratulations, Sally, you get 400 points for that. All right, who wants to go next?
Isabel, Osgain.
Isabel Osgain, 200, all right. A woman is brought to the emergency department in active labor. You perform a pelvic exam and note a prolapsed umbilical cord. Which of the following is the most appropriate next step in the management? A, clamp the cord into places and cut it. B, place a patient in the knee-chest position with the bed in Trendelenburg. C, manually replace the cord into the uterus and prepare for rapid vaginal delivery. And D, wrap the cord in warm packs and prepare for rapid vaginal delivery.
B, place the patient in the knee-chest position with the bed in the Trendelenburg.
And that is correct. Okay, so umbilical cord prolapse, essentially if surgical delivery cannot be achieved in a timely manner, the clinician should perform maneuvers to preserve umbilical circulation. The patient should be placed in the knee-chest position with the bed in Trendelenburg position, as the presenting part is digitally elevated off the umbilical cord. All right. It's an obstetric emergency. Patient essentially will need to go for a cesarean section. Congratulations, Isabel. You get 200 points for that. All right. Who wants to go next?
Frederick.
EMS.
Okay, so I had Frederick and then EMS. So Frederick, which number?
ABG is 500.
Frederick, ABG is 500. Okay, and then someone said EMS?
Janet.
Janet?
EMS 500.
EMS 500 has already been done. All right.
400.
The ones left is 100 and 300.
Okay, 300.
All right, so Janet. Okay, so let's start with Frederick. All right, ABGs 500. Yes, first ABGs to be done. Okay, an 89-year-old patient presents with fever, rigors, hypotension, and reduced urine output. They appear confused and unable to provide any meaningful history. The care home that the patient came from has provided some basic documentation. You look through the information available and then note that the district nurse changed the patient's catheter 24 hours ago. The medical registrar commences antibiotics, aggressive fluid resuscitation, and asks you to perform an arterial blood gas. With the results shown below, the patient was not on oxygen at the time of the ABG. All right. So PaO2 is 12.4 kPas, or normal being 11 to 13, or 93, normal being 82 to 97, as you can see. pH is 7.2, normal being 7.35 to 7.45. PaCO2 is 5.5, normal being 4.7 to 6.0, and the millimeter version is shown. Bicarbonate is 15, normal being 22 to 26. Base excess is -4, normal being -2 to or +2. What does the ABG show?
I guess this is a metabolic acidosis.
All right, Freddy, congratulations. Yes, the patient is having a metabolic acidosis. The patient has presented profoundly septic with fever, hypotension, and evidence of reduced end-organ perfusion, which is the reduced urine output and a bit of confusion. And reduced organ perfusion causes tissue hypoxia, resulting in cells distorting anaerobic respiration, generate energy, anaerobic respiration produces lactic acid, which is what the patient has. So Freddy, you get 500 points for correct answer of metabolic acidosis. Next question was Janet for EMS 300. A child with projectile vomiting, a stiff neck, and a fever causes you to suspect A, croup, B, dendritis, C, epiglottitis, D, meningitis, E, rheumatic fever.
Meningitis.
Yes, you get 300 points. Okay, so patient has meningitis. Okay, features of meningitis: bulging fontanelle, high-pitched cry, vomiting, refusing feeds, photophobia, lethargy, high temperature, low temperature, partial breathing, irritability, seizures, cold feet and hands, floppy limbs, extreme shivering. Well done. All right, who wants to go next?
Lean.
So I had Lynn.
And Nicholas.
ABG is 3.
Okay, so Lynn, ABG is 300, and Nicholas?
PIDS 100.
PIDS 100.
Yeah.
All right, so let's start with Lynn. Okay, Lynn, ABG is 300. 48-year-old male has been admitted with a 24-hour history of abdominal distension and profuse vomiting. A CT scan reveals large mass causing bowel obstruction. As part of the patient's assessment, the surgical registrar requests that you check his blood gas on air with the results shown below. PaCO2 12.7, normal being 11 to 13 millimeters are shown next. pH 7.5, normal being 7.35, 7.45. PaCO2 is 5.5, normal being 4.7 to 6. Bicarb is 29, normal being 22 to 26. And base excess is +3, normal being -2 to +2. What does this ABG show?
Gosh.
Is that your final answer?
Wow. Okay. This shows compensated
This shows a compensated metabolic alkalosis.
Okay, so the patient, yes, has a metabolic alkalosis. I'll give you that. Yes, as a result of the patient's profuse vomiting, they have lost a significant amount of hydrochloric acid from his stomach. The result is a net loss of hydrogen ions, meaning less hydrogen ions to bind to bicarb, and therefore more free bicarb in the system. In addition to the vomiting, the patient's volume is depleted, which results in release of aldosterone and other corticoids that can increase bicarb reabsorption, and also the bicarb is gone up. Good job, Lynn, well done. Nicholas, 100 pediatrics. A 1-year-old boy presents with the rhythm seen above. Physical exam is unremarkable except for tachycardia. Which of the following vagal maneuvers is the most effective to treat this rhythm? A, apply external ocular pressure. B, apply ice to the face. C, blow the patient's face with a straw. D, perform carotid massage.
D.
D, perform carotid massage. Unfortunately, is not the correct answer. Good try. We'll definitely bring it back in the next round. All right. Who wants to go next?
Janet,
Janet, yes.
PIDS 500.
Janet, PIDS 500. All right.
Janet's nakuja.
An 8-year-old girl presents the emergency department in status asthmaticus. The decision is made to perform endotracheal intubation. What is the appropriate cuffed endotracheal tube size?
Okay.
Oh, A, 4.5 millimeters, B, 5.5 millimeters, C, 6 millimeters, and D, 7 millimeters.
Okay. 5.5.
5.5 is the correct answer, all right? Okay, so 5.5 is the correct answer. So how to calculate is pretty much age of the child. So this child is 8 years old, age divided by 4 plus 3.5, so that would be 5.5. For an uncuffed tube is age divided by 4 plus 4 to correct the correct size of the tube. Well done, Janet, on that one. All right, who's going next?
Maureen, EMS.
Maureen, EMS 100. All right, let's have a look at that. What is the name of a bubbling sound in the lungs? A, asthma, B, rail, C, rider, D, strider, E, wheezing.
B.
B, rails is the correct answer. Well done, Maureen. All right, so different noises. You've got rails, which is crackle, smaller airway fluid in the lungs, rhonchi, larger airways, obstruction, wheezing, effects of bronchi constriction, and then strider is an upper airway problem. All right, good job, Maureen. All right, who's going next?
Irene. Emily.
I hear Irene and Emily. So Irene, which one do you want?
Lucky dip 100.
Irene, Lucky Dip 100, and then there was it Maureen? No, sorry, Emily, sorry, yes. Which one do you want?
ABG 400.
ABG 400, all right. So let's start with Irene, then go to Emily. So Lucky Dip 100. Which of the following is not a component of the Cincinnati pre-hospital stroke scale? A, incontinence, B, facial droop, C, arm drift, D, abnormal speech.
A.
A, incontinence is the correct answer, Irene. All right, so the Cincinnati pre-hospital stroke scale essentially is facial droop, arm drift, and abnormal speech, which can be slurring of words or unable to speak. That's the correct answer. All right, then we go to Emily, ABG's 400. You're asked to review a 59-year-old female who has been admitted in the acute medical ward of your hospital. The nurse tells you that she appears short of breath despite currently receiving 3 liters of oxygen via nasal cannula. You take an ABG which reveals the following: PaO2 9.1 kPa, pH 7.3, PaCO2 8.4, bicarbonate of 29, base excess of +4. What does the AB, the normals are shown on the side there. What does the ABG show?
Respiratory acidosis.
All right, Emily. Yes, your patient has respiratory acidosis with metabolic compensation. So the known patient has COPD, which is chronically elevated level of CO2. As you can see, the CO2 is chronically elevated, but the patient is acidotic. Sorry, the backup is elevated also, and the CO2 is also up, and so it's a respiratory acidosis. As a result, metabolic system has a hard time to compensate by generation of vegetation of bicarbonate to oppose further increase in pH, explains why the pH is only slightly acidotic despite a significant rate of CO2. So your answer is correct, respiratory acidosis with metabolic compensation. All right, so.
Maureen?
Yes, Maureen?
Lucky dip 200.
Maureen, all right. Maureen, lucky dip 200. In anaphylaxis, the correct method of administering adrenaline is A, establish a large bore IV access and administer an IV adrenaline, give IM in the left deltoid, give IM in the lateral thigh, give IM in the gluteal region.
C.
Give IM in the lateral thigh is the correct answer. Well done, Maureen. All right, so in anaphylaxis, give IM 0.3 milligrams adrenaline in adults in the lateral thigh. That's the correct answer. All right, so just the questions that are remaining so that you know, there's PIDS 200, there's OBGYN 100, there's ABG 100 and 200.
ABG 200, David.
ABG 200, David. Someone else? OBS, I had OBS.
Then Janet.
Isabel OBS 100. All right, Janet, which one?
PIDS 200.
PIDS 200. All right, so let's start with those ones first. So, David, ABG 200. A 17-year-old patient presents to the Erand complaining of tight feeling in their chest, shortness of breath, as well as some tingling in their fingers and around their mouth. They have no significant past medical history and are not in any regular medication. An ABG is performed on the patient while they are breathing room air, and the results are shown below. A PaO2 of 14 kPa, which is normal, is 11 to 13. pH 7.49, normal 7.35 to 7.45. PaCO2 3.2, normal 4.76. Bicarb 22, normal 22 to 26. Base excess +2, normal -2 to +2. What does the ABG show? Yes, David, we need an answer.
The PO2 is 105.
PO2 is 105, but normal is 82 to 97, as you can see there.
Respiratory alkalosis.
Respiratory alkalosis is the correct answer. All right. So respiratory alkalosis occurs as a result of increased ventilation, which can be caused by any of the following: anxiety or panic attack, pain causing increased respiratory rate, hypoxia often seen in ascent to altitude, pulmonary embolism, pneumothorax, iatrogenic from excessive mechanical ventilation. The history of a healthy young person hyperventilating with peripheral and perioral tingling would be fairly typical of a panic attack. So that's what your patient was having. All right, so next we go to Isabel 100. OBGYN, let's see. A 32-year-old gravida 6 para 5 woman presents with active contractions stating, I have to push. Exam reveals crowning at the perineum. Which of the following maneuvers is most appropriate to have a traumatic delivery? while you await the arrival of an on-call OBGYN? A, gentle pressure on the perineum. B, prophylactic episiotomy. C, upward pressure on the inferior portion of the head to direct away from the perineum. D, vigorous stretching of the perineum prior to delivery of the head.
A, gentle pressure at
100 points for you, Isabel. Yes, gentle pressure at the perineum. So rapid delivery of the head can result in a third or fourth degree perineal tears. Applying pressure at the perineum can help prevent rapid delivery. As the head emerges from the introitus, the perineum should be supported by a sterile towel placed along the inferior aspect, held in place by one hand. The other hand should support the fetal head. As the infant's head presents, the inferior hand may be used to control the fetal chin, while the superior hand remains on the crown of the chin. On the crown of the head, supporting the delivery. Once the head delivers, the fetus should be evaluated for nuchal cord. Good job, Isabel. All right, so we got Janet, 200 beats. Which of the following medications can be given to a 6-year-old in cardiac arrest via an endotracheal tube? A, atropine. B, calcium gluconate. C, dextrose. D, vasopressin.
Via an ETT.
Yes.
Vasopressin?
Vasopressin, unfortunately, is not the correct answer. All right, so it goes back to the board. And the final question, still on the board, is ABG 100. Who's taking it?
Maureen.
I had Maureen. All right, so Maureen, ABG 100. You're asked to review a 63-year-old female who was admitted with shortness of breath. On your arrival, the patient appears drowsy and on 10 liters of oxygen via mask. You perform an ABG, which reveals the following results. PaO2, 7, normal being 11 to 13. pH, 7.29, normal being 7.35, 7.45. PaCO2 is 9.1, normal being 4.7 to 6. Bicarbonate is 26, normal being 22 to 26, and basic sense is +1, normal being -2 to +2. What does the ABG show?
Respiratory acidosis.
Respiratory acidosis is the correct answer. For 100 points, respiratory acidosis has been caused by type 2 respiratory failure, a failure of ventilation because the oxygen levels are fine, leading to an increased levels of CO2. Potential causes of type 2 respiratory failure: increased airway resistance in your COPD or asthma, reduced breathing effort, drug effects or brainstem lesions, extreme obesity, decrease in the area of the lung available for gas exchange. Neuromuscular problems will give you that, and then deformity, ankylosing spondylitis, or flail chest. All right, and with that, we have come to the end of this part. There's still some questions that were answered wrongly, which we shall bring back to the table. All right, so I will give you the questions, and then you can pick the ones that you want to do. All right, please wait for me to finish reading. You can note them on the side there, then decide the ones you want to do. All right, so the questions that are still on the board: pediatrics, 100, 200, 300, 400. Okay, EMS, 200, 400, 500. Lucky dip, 300 and 500. All right.
EMS 500. David.
400.
Nicholas.
Okay.
It's 400.
Right. Let's start.
Nicholas, it's 300.
EMS 500.
All right. I've had EMS 500. Who's that?
David.
Vivian.
Maureen was louder. Yes. Okay. So Maureen, EMS. Oh, Maureen, EMS 500. All right.
Yes.
Just a second. Sorry, Maureen. All right. Let's have a look at that question. EMS 500. How often should you give breast to an adult when ventilating? A, once every 1 to 3 seconds, once every 4 to 5 seconds, 5 to 6 seconds, 6 to 7 seconds, 8 to 10 seconds. And your answer is C, once every 5 to 6 seconds is the correct answer. All right, so you get 500 points for that, Maureen. Adults, 1 breath every 5 to 6 seconds. Children, 1 breath every 3 to 5 seconds. Infants, 1 breath every 3 to 5 seconds. All right, who's next?
Nicholas.
Nicholas. I had Nicholas first. Nicholas, what do you want?
It's 300.
Nicholas feeds 300. All right. So let's say Nicholas. Okay, so feeds 300. So just for the next one, just shout your name so that I pick up your name first and you tell me what you want. All right, so Nicholas feeds 300. Which of the following is the most characteristic of a complex febrile seizure? A, convulsions are focal in nature. B, convulsions lasting 12 minutes. C, second seizure occurs with second febrile illness. D, single seizure that occurs at a temperature of 40 degrees centigrade. What's your answer?
I'd go for B.
B, convulsions lasting 12 minutes, unfortunately, is not the correct answer. All right, the correct answer is focal seizure, is convulsions are focal in nature. So looking at febrile seizures, so simple ones, age 6 months to 5 years. Complex ones, number of seizures normally 1 for simple seizure. Duration normally less than 15 minutes, so 12 minutes is within the time. No focal features. Presence of focal features makes it a complex febrile seizure with concerning features. Resolution, medication normally not required unless it's a complex febrile seizure. Normally the patient will not return to a baseline. So 4 more febrile seizures in 24 hours, more than 15 minutes duration or more than 5 minutes duration plus benzo. Focal features, medication required, all this make it a complex febrile seizure. So criteria for a febrile seizure, convulsions associated with temperature more than 38 degrees centigrade, child older than 6 months or younger than 5 years, absence of CNS infection inflammation, absence of acute systemic metabolic abnormality that may produce convulsions, and no history of a previous febrile seizure. So unfortunately, Nicholas, you don't get any points for that question. Who's
David.
next?
David.
Vivian.
Okay, you have to be fast, people. David, what question do you want?
Lucky dip 500.
Lucky dip 500. Okay. Yes. Okay. So lucky dip 500. Let's have a look at that. So you're an EMT on scene. Which of the following following a lightning strike on a wet field? There are 4 people affected by the strike. Which of the following requires the most immediate attention? 18-year-old woman breathing in pain with an open lower extremity fracture. 27-year-old pregnant woman complaining of abdominal pain. 59-year-old man with absent vital signs, and 7-year-old boy breathing with a radial pulse but otherwise unresponsive. What's your answer?
D for dog.
D for dog, and fortunately is not the correct answer. All right, so the correct answer here is a 59-year-old man with absent vital signs. Why? Okay, individuals in a mass casualty lightning event, what we call reverse triage, where individuals who show no signs of life should be attended first, and prolonged CPR should be undertaken because the main problem is respiratory depression, and that's where they cardiac arrest. So CPR will probably bring them back to life. Individuals with signs of life pretty much are likely to survive without immediate intervention, and they'll be fine. You don't need to worry about those ones. Okay, so
Maureen.
Naomi. Emily.
Gotcha. Standard mass casualty triage. Yes. Standard mass casualty triage does not apply. All right, so that is mass casualty events. Who's next?
Nicholas.
Emily.
Nicholas was fast. Yes. Okay, you have to shout on time. When I ask who's fast to shout, Nicholas, what do you want?
I want PIDS 100.
PIDS 100. Okay. All right, a 1-year-old boy presents with everything seen above. Physical exams are remarkable except for tachycardia. Which of the following vagal maneuvers is the most effective to achieve this rhythm? A, apply external ocular pressure. B, apply ice to the face. C, blow the patient's face with a straw. D, perform carotid massage.
B.
B, apply ice to the face is the correct answer. All right, so supraventricular tachycardia management. Vagal maneuvers includes cold stimulus to the face, Valsalva maneuver, blow through a straw, not for the patient, not you as a doctor or the nurse or EMT. Stimulator gag reflex, okay, these are some of the options you have. Should not be performed, carotid massage and orbital pressure. Please do not do those ones. Medications, adenosine the first line, then you have propiamide, abiraterone, and beta blockers. Unstable patients need to be cardioverted, 1 joule per kg. All right.
Vivian.
Emily.
Wait. We're okay. Who's next?
Naomi.
Vivian.
All right. I had Naomi loudest. I can't say there are too many. Naomi, what do you want?
Kids 400.
Naomi, so this one. Naomi, PIDS 400. Okay. Okay, so Naomi PIDS 400. What is the best, which of the following best classifies this fracture? Salter 1, Salter 2, Salter 3, or Salter 4?
Salter 3.
Salter 3 is the correct answer. Essentially, Salter also stands for slipped upper, lower, through, and erasure of the growth plate. So slipped is just a slipped through a slipped disc. Above the growth plate. Lower than the growth plate. Through is through the growth plate, and then pretty much crash injury to the physis. So this would be accurately a Salter 3 classification. So you get, Naomi, you get 300 points for that. Who's next?
Emily.
Emily, yes. Emily, what do you want?
EMS 200.
Emily, EMS 200. All right. Give me a second. Emily. All right. EMS 200. Which of the following is not used to report level of response? AVPU, GCS, RTS, SALT.
B, SALT.
SALT is the correct answer. You get 200 points for that. So AVPU is alert, patient is awake, responds to verbal stimulation, patient responds to painful stimulation, and patients are completely responsive. That is AVPU. In GCS, you have eye-opening verbal response and motor response. And revised trauma score does have GCS as part of it. And then there is systolic blood pressure and respiratory. SALT is a mass casualty triage system, does not discuss level of response or level of consciousness for the patient. Okay, who's next?
Vivian.
Vivian. All right, Vivian, what do you want?
EMS 400.
EMS 400. Okay. So EMS 400. What is the adult dose for activated charcoal? A, 10 to 30, 30 to 40 mLs, 50 to 100, 60 to 100, 150 to 300.
30 to 40.
30 to 40 mLs, unfortunately, is not the correct answer. All right, the accurate dose for activated charcoal in adults is actually 50 to 100 grams. Indications, life-threatening dose of the toxic substance ingestion less than 60 minutes. Contraindicated to airway problems unless intubated, increases co-aspiration, this is from hydrocarbons, caustic ingestion, need for endoscopy. Anyone who presents after 60 minutes should not get activated charcoal. Toxins poorly absorbed by activated charcoals, iron, lithium, alkali, mineral acids, and alcohols, and of course, patients with intestinal obstruction. So the dosage essentially is, as you can see, for less than 1 year old, 10 to 25 grams, 1 to 12, 25 to 50, above 12, essentially 1 gram per kg or 25 to 100 grams. Multi-dose activated charcoal, which is every hour, is recommended for carbamazepine, dapsone, phenobarbital, and theophylline dosage. This is also available in our protocols. Who's next?
David.
David, what do you want?
Lucky tip 300.
David, Lucky Dip 300. Which type of alcohol poisoning causes blindness? A, ethanol, B, methanol, C, isopropyl alcohol, D, ethylene glycol.
B.
B is methanol and is the correct answer. All right. So ethylene glycol essentially causes kidney damage. Methanol, which is this one here, causes production of formic acid, which leads eventually to retinal optic nerve toxicity and blindness, which is what a good number of people in central Kenya have been drinking. Symptoms: dizziness, disorientation, blurry or snowy vision and blindness. Treatment, we normally don't have omeprazole, but we have access to ethanol, which people drink every weekend. So ethanol is present in vodka, gin, whiskey, rum. Ethanol content is actually should be at least 35%. Okay, quickly checked. Tequila has 35% ethanol. All right, and the dosage is there based on body weight. And so the treatment for a patient who comes in with methanol poisoning is alcohol. Give them loads and loads of alcohol. Yes, okay, and the dosages and treatment are available on the protocols. Who's next? Okay, so questions still remaining since no one, let me just go through them. We have PEDS 200. Yes, PEDS 200 is the last question available.
Sally.
Sally gets PEDS 200. Okay. Which of the following medication can be given to a 6-year-old in cardiac arrest via endotracheal tube? A, atropine, B, calcium gluconate, C, dextrose, D, vasopressin.
A.
A, atropine is the correct answer. All right. Okay, drugs that can be delivered via endotracheal tube in adults: naloxone, atropine, vasopressin, epinephrine, and lignocaine. In pediatrics, you have lignocaine, atropine, naloxone, and epinephrine. And with that, that brings us to the end of round 2. We'll take a quick 5-minute break so that before we announce the final results, we'll leave the mics on so you can all have a chat with each other. We'll announce the results at 11:30 sharp. So we have 5 minutes. We'll not play the music, just let you guys interact and yes, have fun. Okay. Yes, you can chat to each other. Mjuane.
Who is David?
David, introduce yourself.
Hey, Daudi unataka jacket, eh?
What is? Umechukua zote?
Ati?
Devi sasa.
Poa.
Hello, uko on point.
Sally amepotelea PEDS.
Kwanza, I couldn't believe that I missed that one for CPR, bwana. How could I say 6 to 7?
Oh, I'm like, funny.
Mpaka I almost said, the 5 to 6 wasn't there. He's just put it.
Even the one for EGT, I'm thinking, why couldn't adrenaline just be there? Because that's what I was so sure about, you know?
Jana leo uko off?
Nimetoka night. Niko off. I just actually, that is why I got in late, because I was from night duty.
It was a calm one. You've not even slept?
I haven't slept. I'm so tired.
I can imagine. That is commitment to the core, mega.
Imagine, and I have to think through these questions. My God. I was avoiding the ABG ones with a plate because I was gonna think so hard. But they were very simple.
I know. I know. Kwanza they were guys delayed me on answering those ones.
Yes,
No, but they were straightforward actually. They were not complex.
Yeah, they were very straightforward.
Yeah.
You guys are ready for next week? It's just Devi. Oh, okay. Devi, are you ready? Your class is starting on Monday.
Of course. Niko na wewe.
No, I'm not with you.
I know. I'll be in your office all through.
Oh, you'll be in my office. Yeah, I'll be receiving you actually in the morning. I'll be there with you. Don't worry. I will have you settled.
But you are welcome for the training.
Yes, I will come. I will be there on in and out. I'll come see what you guys are doing.
Okay. All right, so for the winners, okay. Remember, first prize was a hoodie, second prize was crabs, third prize was protocols. So number 3 is Freddie at 1,500 points. Kudos, Freddie. Number 2 is Maureen at 1,700 points. And the winner is David at 2,200 points. Well done. Please drop us a message on our group or send us an email to arrange for collection of your gifts. Thank you everyone for participating. Hope you guys had fun, and more importantly, hope you guys learned something. And we'll see you at the end of next month, where we'll have our next exciting session of our monthly open mics, emergency care open mic sessions. And any questions, comments? There is a feedback form. Okay. So there's a feedback form. Please, we'll send that through to everyone, and you can please give us your feedback on these sessions, and in case you have any suggestions on how we can get better, also welcome. Any last comments? Last comments? I hope you guys learned something.
I really enjoyed it. It was very nice and educative. Thanks.
Yes, we hope you guys next time when we arrange the next one, yes, come early and come ready to win. Msiogope sana. Yes, it's very easy. All right, so I want to put the feedback form on the chat. Please give us your feedback so that we can make this better. So I'm just pasting it on the chat. So please give us your feedback. The form is on the chat. All right, otherwise, thank you everyone, and we'll see you guys end of next month. Bye, enjoy your weekend. The form, please use the feedback form on the chat to give feedback.
Bye, thank you.
All right, bye.
Bye. Nice weekend.
Bye. You too, bye.